conducted many surveys, town halls, workshops. We reached out to over 80 of our best clinical trialists here at the University of Michigan. We heard loud and clear that we needed to support clinical trials, both the activation of clinical trials and the recruitment and enrollment of patients into these clinical trials. So we launched a subcommittee for the clinical trials assessment, which really was comprised of a number of the chairs that actually had their faculty running clinical trials. It was supplemented by other researchers. We have tens of millions of dollars commitment from both the dean and the senior associate dean for clinical affairs, which I think is a great commitment from the administration that we have identified that we need to fix this problem, and we are well on the way to doing that. The Clinical Trials Committee realized they needed to think about a new way to do clinical trials. What came up was a federated system where certain of the activities would be conducted centrally through the dean's office, and certain activities would be out in what are called nodes, which are actually specific themes of clinical trials. Themes around oncology, themes around pediatric problems, themes around cardiovascular problems. Activities that will be held centrally will be the clinical trials management system, which will be the IT infrastructure to allow individuals to identify cohort discovery. A lot of the IT that will be coming in with data, the research clinical billing will be held centrally within this IT structure to make sure that the one charge goes to Medicare and all the rest of them go to the clinical trials, actually to keep us compliant. Things like standard operating procedures, a lot of the training that all of the study coordinators will need to go through are all going to be held centrally. By 2018, when all of the nodes are up and running, all of our clinical trials will have equal opportunity to adhere to the node infrastructure. There will be financial support, there will be clinical coordinator support, there will be support to review protocols before they go to the IRB. There'll be a significant amount of what we call our enablers to make sure that these clinical trials aren't just numerous, but also are extremely high quality, which is really one of the aspects that we are trying to strive to increase the quality of the clinical trials that are run through our academic medical center.